My name is Susan Reyna Guerrero. I'm here today with Angela Hamberlin. We are from Beacon Therapeutic, and for the next 30 minutes, you'll be hearing about the FACT Project. A little bit about Beacon. We're a non-for-profit social service organization that's been around since 1968. We have 4 different locations, and I will go over that in a moment. But since 1968, we've really been helping families create new endings from disadvantaged beginnings. And we do that through a series of programs that we offer in the Beverly area as well as citywide. And I'm going to put a listing of those programs right now on. So we have 2 therapeutic day schools. Our schools actually were the first programs that evolved back in 1968. We have a shelter outreach services program where we're providing mobile mental health services to homeless women and children throughout the city of Chicago. We have a children's health insurance program where we're enrolling children into Illinois' All Kids program. We offer early Head Start services. We have a FACT program that Angela will be filling us in about later on during the show today. We have a family homes program that's working with highly vulnerable homeless families, helping transition them into permanent housing and stability. We have a PATH program, a project for assistance in transition from homelessness, and it's helping chronically mentally ill families or heads of household, again, move into permanent housing. We have 2 intensive outpatient programs, one for children, small children, ages 3 to 5, and then another one for children's ages 6 to 18. And then we have traditional outpatient mental health services. We do this at our different locations, and we do have 4 different locations. Our administrative offices are located at 1912 West 103rd. Our homeless outreach services are all based at our facility on Western Avenue, 11740 Southwestern. Our high school program is located in Calumet Park on 12440 South Ada. And our Longwood campus actually houses most of our programs, our elementary school, our intensive outpatient program, as well as our traditional outpatient mental health clinic. I'm here today with Angela. We're going to be talking about our FACT program. So for the next 30 minutes, you'll be hearing about some of the great work that's going on in that project. If you have any questions or comments, please feel free to call us. This is a live call-in show. The number is 312-738-1060. So please call, because otherwise we're going to be talking the whole time, and maybe we can respond to some questions or comments that you have. So Angela, thank you for joining me today.
Thank you.
And tell us a little bit about, you are the Children's Services Clinical Manager.
Yes.
Okay, so tell me a little bit about your background, first of all, and how you got involved with Beacon.
Sure. I am a licensed clinical professional counselor. I've been with Beacon for 5.5 years. I've worked across various programs, outpatient programs, the day schools, elementary and both high school, and also had an opportunity to kind of transition over to our FACT program.
And FACT stands for Family
Assertive Community Treatment.
Okay, so tell me a little bit about, what is the FACT project?
Well, again, the FACT project stands for Family Assertive Community Treatment. It is based on an ACT model, and pretty much taking this medical model and putting it out there to the communities and the families that we serve. So actually just pretty much talking about working with families and taking this model and putting it out into the community.
And I know, ACT is evidence-based.
Yes.
And so what we were able to do, and actually just, and I know this because I've been involved with the project from day one, it was a great opportunity that was funded through the Conrad Hilton Foundation. And it was really the charge from the Hilton Foundation was to identify a model that would work effectively with young moms and children.
Yes.
So I know the project has multiple goals. One of them is to impact the mother's well-being, the child's well-being, the system, and the family's well-being.
Yes.
So tell me a little bit about who is on the team for FACT, because it is a team model.
Yes.
So who's on the team?
We have 6 members that are on the team. We have 2 supervisors. One supervisor that specializes in adult services, and myself, who specializes in the children's services. We have a parent-child specialist. We have an employment specialist. We have a housing specialist, and we have a substance abuse therapist.
And then I know the other member of the team is a systems integration manager.
Yes.
And I know that person really is both part of the team, but also steps outside of the team really to look at the landscape in which the families exist and how we can impact the landscape so that the changes that we're making are really long lasting.
Yes.
So who are we talking about? Who's served in this project? Who are the people that really benefit from these services?
Well, basically, in the city of Chicago, FACT has really serviced 46% of the homeless families. So we're looking at families that are homeless, that require services such as employment, help with their children. So we're really looking at a really large population, especially with, our specialty is working with young moms. So those are the people that really benefit from our services.
I'm actually going to put on what is the eligibility criteria, because it is very specific, and you're describing a team of 6 professionals, and it is a very intense service model. So
Yes.
this model really isn't for everybody.
Right.
It is really for a very specialized, highly vulnerable group that really can't access traditional services. So we're talking about young moms, ages 18 to 25. They have to have at least one child under the age of 5. They have to be homeless or at risk of homelessness. The parent needs to have some type of mental illness, substance use issue, or coming from some domestic violence situation, and or they have a history of child welfare involvement, and then they lack limited social supports.
Correct.
And I think one of the things that I know we've been challenged with is because this is such an intensive model. And when we think of the needs of homeless families, there's this whole continuum. Some need very little support, and then some need a lot of support.
Right.
And really who you're talking about is those that really need a lot of support to get them housed, to get them stable. And I know some of the specific services, in fact, really are geared towards certain things. And I know your specialty is associated with the parent-child relationship, with the children's services, and there's some specific things that FACT offers that are unique. So I know we offer child-parent psychotherapy and then the Preventing Child Abuse and Neglect curriculum. Can you tell me a little bit about what CPP, child-parent psychotherapy, is?
Sure. It's an evidence-based model that was actually designed by Patricia Van Horn and Alicia Lieberman. It focuses on trauma with kids between the ages of 0 and 5. And it's a relational model. It works with the parent-child relationship, the caregiver. So it actually is a pretty intensive model. Most of the families that we serve usually is involved in this type of treatment for at least 18 to 24 months, or when they decide that treatment is no longer necessary. So it's actually a really good model to help to build relationships between the parent and the caregiver.
And I think we were able to introduce this model, the CPP model, into this population for some very specific reasons. We very much know what the impact of homelessness is on children and on child development and the parent-child relationship. And the absence of a solid parent-child relationship really can lead to long-lasting impacts on that child for their self-esteem, for their development, for their educational achievements, for their health. So truly recognizing that the traumas that homelessness bring to a child is something that we feel obligated to respond to. So being able to bring CPP to this population has been very important because we're making an impact. But it is very intensive work.
Yes, absolutely.
And I know when we talk about it being evidence-based, the point to that is when we talk about evidence-based, we're emphasizing that this has been researched, it's been studied, and if you implement it according to how you're supposed to, research supports the fact that it'll be effective.
Exactly, okay. Absolutely.
So in the end, this will help the parent-child relationship.
Right.
So now I also mentioned PCAN, Preventing Child Abuse and Neglect. What is that?
It is a curriculum designed from the 0 to 3. And it actually teaches the impact to help caregivers to be able to support and educate parents in preventing child abuse and neglect. So we use that. It's a very easy to use curriculum, and it offers an array of educational tools to kind of help our parents and caregivers.
And again, knowing what we know about homelessness and the level of child welfare involvement, DCFS involvement, being able to provide the parents with tools and knowledge that will help prevent them from engaging in any type of abuse or neglect is really important, because that way the family can stay together.
Right.
So you've been doing this for how long now? You're saying 5 or so years. You've been in this current position how long now?
I've been in this current position for 7 months.
Okay, I know. God, who would have thought? You've been doing a great job. So tell me a little bit about are there some particular success stories or some particular families that you've worked with that really made you realize, okay, this is why I want to do this, or this
Oh my God, Susan, I really get excited about this when I talk about the success stories, because this is where the real work is. I mean, we can sit here and talk about, our program and all the wonderful things that we're doing, but this is what really matters. So when we're looking at success stories, I worked with a number of families. I had the opportunity to work with a number of families prior to coming on board with FACT. And actually, one family in particular kind of stands in mind because she was a young mom that has 6 children, and she actually utilized all of our services that we had, not only just with FACT, but she utilized our services with Early Head Start. She utilized our outpatient services, Little IOP, which is Little Intensive Outpatient Services.
As you're talking, actually, I'm going to put some pictures of the kids on, because I think it really brings home who it is that we're talking about.
And she utilized our Big IOP services, which is Big Intensive Outpatient Services, which kind of focuses on children between the ages of 6 and 18. And actually, she was, throughout our process of working with her, she was actually able to get housed, find employment, and just really is benefiting, and also is receiving mental health services as well from our program, and actually is doing extremely well. And really just thank our program for helping her. And she's actually been in our program now for quite some time. So.
Yeah, and I think when we look at, the successes that you've just described, it's a lot of work up front for the mom and for the family.
Yes.
But if we think about the long-term impact, what we're doing, we're providing this mom with skills that, she, hopefully will need less and less support over time.
Absolutely.
Her children will be set on a proper developmental trajectory in terms of being on task at school, getting their health needs taken care of. The mom can get her health needs taken care of. So I think these are all things that, yes, we're investing a lot in the family up front, but the long-term payout is really significant.
Right.
I understand we have a caller. Yes? Caller?
Yes, hi. Along with these great services that you're providing the families, is there anything the larger community can reach out and help in terms of resources or things that you might need to help these families sustain on themselves?
God, that's great. Thank you. Yes, actually there is. What we're describing clearly, a lot of our services are funded through state grants, private grants, and fundraising, but our families need so much, and there's very few resources that are available to cover some of the things that our families need. One of the things in particular that I know we're always looking for is that we have these Fresh Start kits. You mentioned the mom got housed.
Right.
Well, so one of the things that we do is that when families are housed, we provide them with Fresh Start kits. We call them Fresh Start kits, or Little Fresh Start kits. And essentially, it's those kinds of things that people usually get when they get their first apartment. So it's linens, it's pots and pans, it's those kinds of things. So Beacon is always looking for donations of those items. We do accept gently used items as well. And I'll put our contact information on at the end, or you can call the number on your screen, and our Jenny, who's answering the phones, can provide you that information as well. But we are always looking for support from the community, and we're fortunate. We live in a community that's been very supportive of us, and then we're always struggling with finding ways to get the larger community to support us as well. So donations of items, we also have fundraisers coming up, and I'll put that information on as well. We have actually a big one coming up in July. So that's a good question. Mm-hmm. What would you say are some of the more challenging things, Angela, that you have faced or that the program faces, in terms of the work that we're doing?
Well, basically, overall, on a systemic level, is that there's just that we need more funding. We're in, based on the economy, sometimes we're just really out there trying to rally and get more monies to provide more supportive services for our families. And just as what you mentioned, basic needs things, sometimes those things are just really hard to come by because of the lack of funding. So when we're looking at it more on a bigger picture, that absolutely if people want to donate money for our program, we'll gladly accept it. But any donations as far as basic needs are concerned, like toiletries, things for the family, just basic stuff. We can always.
Since you're going on about that, I am going to put our contact information on now. There is our website. You can go on the website, Beacon. There, it's www.beacon-therapeutic.org. You can call there, And you can make donations actually online, or you can contact us and we can go out. We're always accepting actually even furniture. I know because lots of times our families need couches and beds and those kinds of things. And many times families, need to, they buy new things and they don't know what to do with their old things. Well, we'll gladly accept that. So that's for sure. So thank you. That's a good point. In terms of your title is Children's Services Manager. So I know you work with FACT, but you also do some work with our other homeless services.
Absolutely.
So tell me a little bit about that.
Basically, my role with working with the shelter outreach program is that I do a lot of collaboration with services to ensure that our clients get the services that we need and to provide continuity of care. So with a lot of families that we provide a very comprehensive service, we provide comprehensive services, we need to make sure that we're communicating amongst programs, collaborating, and ensuring that our families get the best services possible, and especially as it pertains to children. So a lot of times we often kind of focus on the adults and the services that they need, the basic needs of housing and employment, but oftentimes children are kind of like left on the sidelines, and so we try to collaborate and provide different resources as far as helping them to make sure that the kids get what they need, whether it's collaborating with the schools, Chicago Public Schools, arranging staffings, IEPs, providing any type of children resources to kind of move the families forward.
And I know with the new homeless definition, HEARTH, there has been an increased commitment to really look at the children's needs. So I know within the homeless system, there is now a requirement that each shelter have someone that's designated that's going to be working with the school district or addressing the children's needs. But I know at Beacon, we really look at the whole child. So we're looking at their health needs, their development needs, their educational needs, and then of course we're looking at the parent-child relationship, which is really important. So I could see your role continuing to grow in terms of making sure that everybody really is looking at the whole family and not just the child.
Exactly, absolutely.
And that's really important. And it's accessing those resources. I know, earlier today, actually, we had the meeting with, about home visiting programs and understanding the early intervention services versus the Head Start services versus the home visiting services. And the key with all of these services is really making sure that we're identifying early enough any special needs children have so that, if you intervene early enough, once they get to school, either the issues have already been addressed or they've already been identified, and then the child can really plug into the right services. I understand we have a caller. Yes?
Yes. How you doing?
Fine, thank you. Did you have a question?
Yes, my name is Mr. Carwell, and I was looking at the program about housing, and then I was looking at y'all was saying y'all only helping females, young females. I was wondering about father with 2 kids.
And it's interesting. I'm glad you pointed out to us. The initial grant funding only allowed us to work with women heads of household, and based on what we know in national statistics, the average homeless family really does consist of a young mom with 2 children. But we have found increasingly that fathers are out there with their children as well. So we will provide services to anybody that presents. That's very key. This particular project really has focused on young mothers and their children, but we do also work with fathers and their children. It's a different set of resources many times, and even with our FACT families, even if it is a female head of household, if there is a father figure or an adult male figure that's part of the family, we will include them in as well. So yes, even though this particular project was launched identifying young mothers, we do work with fathers as well. And we will get single fathers. We will sometimes also get a 2-parent household, where there is a father and a mother, or a mother and a father and a father. But we will work with both. So thank you for asking that question.
And absolutely, we do have our other programs actually service fathers. And I have actually worked with young fathers as well, or fathers that have small kids. But just as Susan was saying, this particular program really doesn't focus on that, but our other services do.
Yeah, so we always provide all the services. They're fully wraparound services. We were talking about the long-term impact, and maybe have you heard from your colleagues of some of the families that have been involved with us for a long time and their ongoing successes?
Absolutely. I just actually, we had a conversation with our FACT team, that actually one of our housing specialists, actually, she ran into one of our old participants actually doing a home visit with one of our current participants. And one of our families invited her into our apartment, and she wanted our housing specialist to kind of look around her apartment. She has been stably housed for about 3 years. That she has all of her children there intact. They're going to school. She's working, and she's happy. So for her to just in passing and to say thank you to our program, I think it just speaks wonders.
Yeah. And I think when we're talking about young moms, and I know this program, and I've talked to some of our moms in this program. I mean, you know, an 18, 19-year-old with pretty horrific backgrounds.
Absolutely.
Of significant abuse, significant neglect, substance use, multiple foster homes. You know, where I really do feel, had we not become involved, you know, I truly wonder what would have happened to some of these young ladies. And I think what the program, what I've seen provide is truly empowering them, allowing them to really, because they're all deeply committed to their children. And I think that's something that's always impacted me, is that they really want to do better for their children. They know what they've been through. Mm-hmm. They don't want to see the same for their children. Mm-hmm. So they will do everything they can to keep their children. But sometimes there's no supports to do that. So they do end up losing their children. So you were just saying right now that this mom was so happy that she had all her children. For some of the moms, that's really important. And it's not that they want to give up their children. But if you're on the streets, there, you know, sometimes it's very difficult to be able to hold on to your children.
Absolutely. I think what you're describing is very complex traumas that really impact our families, and it is amazing that the work that we do, I think it's important to say that it is very intense and is very complex. So when you're looking at that, you have to keep those things in mind, that I haven't ran across a family that didn't want the best for their children. That's the number one thing. Like, I want what's best for my child. I want to do better for them than what was done for me. So I think that that's an important point.
And what you're describing is the point of engagement, actually.
Yes.
Is that's, you know, I think the mothers have their own challenge, but if you're able to show them that you can help your child, we can help you help your child, they engage.
And absolutely. It's building those relationships.
We only have a few minutes left, and I'm mindful of, you know, you've done so much. Where would you like to see things going in, you know, let's say 2 to 3 years with the project?
I want to say I want to keep it going. That's the key. And to make sure that, you know, projects like this, they require funding. And I think it's really important. And I think that when you ask questions, why is it important for us to have programs such as these, I think that it speaks for itself. So we have families out there that really need the services and really actually utilize them if they have access to them. So I just think that it's just a great thing to keep it going, to continue with the children's piece, to continue with housing and providing more resources for housing and more opportunities for employment. So it's just an extension of what we're already doing.
We're running out of time, but I think you brought up some two real big challenges, is the housing and the employment.
Yes.
And we know that those are areas that, of course, nationwide, that's an issue. But I think some of the advocacy work that we're doing is really making sure that when these decisions are being made about housing programs and about employment resources, that, you know, our challenge is to make sure that people are thinking about, what about, you know, vulnerable families? What about, you know, how do we get, you know, moms to get their GED and dads to get their GED, and how does that go on a go forward basis? So, Angela, thank you so much for joining me today. This has been a great show.
Thank you.
And it went by very quickly, right?
Yes, it did. Yes, it did.
I'm going to put some final information on about Beacon, about some upcoming events. Here you go. So if you have any questions or comments, please feel free. You can log on our website, www.beacon-therapeutic.org. We have a breast walk coming up May 12th. Our Ridge Run is May 27th. We will soon be talking about our Beacon Run Home Chicago team, and that's on June 9th, so we'll be looking for pledges for that. A cycling classic that we host on grounds is July 18th. And then the Beacon Bash, which particularly supports our Early Head Start program and our FACT program, is scheduled for July 25th at Joe's on Wheat Street. So thank you very much, Angela.
Thank you.
And we'll see everyone next week. Thank you.